Dog and cat kidneys are located mid-abdomen just below the spine. Kidneys have three primary functions: filter waste products, remove excess fluids, and remove acid to maintain a healthy balance of water, salts, and minerals. When the kidneys become damaged, they do not filter blood as well as they should, and this is a condition called chronic kidney disease, or CKD for short. Nephrons are the functional units within the kidneys. While humans have approximately 1 million nephrons per kidney, dogs have only about 400,000, and cats even less, with only 200,000 nephrons per kidney. Kidney disease occurs when nephrons become damaged and lose their filtering capacity. Damage to nephrons may happen quickly as the result of injury or poisoning, or, as with most cases, slowly over time. Nephrons work through a two-step process. The glomerulus filters the blood, and the tubule removes wastes and returns important substances to the blood. When nephrons are lost, glomeruli are unable to filter the blood adequately, and waste products and excess fluids can build up in the bloodstream quickly. In addition, excess ions, water, and nutrients will be lost in the urine due to insufficient tubule activity. There are 4 stages of kidney disease that are directly related to the loss of nephron function. During the initial 2 stages of kidney disease, a pet parent may not notice anything wrong. However, lab results will indicate an increasing loss of kidney function. Kidney values that we pay most attention to with kidney disease are BUN and creatinine. BUN, or blood urea nitrogen, is a measure of the amount of urea nitrogen in the blood. Creatinine is a chemical compound left over from energy-producing processes in the muscles. Both BUN and creatinine values will increase as the kidneys lose their ability to filter and excrete these waste products in sufficient amounts through the urine. As kidney disease advances to stages 3 and 4, you may start to notice your dog or cat drinking more water, an increase in urination, weight loss, decreased appetite, lethargy, or edema. Kidney failure is the final stage of kidney disease and can be defined as the inability of the kidneys to play their role in supporting proper functioning of the body. A gradual loss of kidney function is a normal result of aging. However, chronic kidney disease in younger dogs and cats is not considered normal. Contributing factors to CKD include medications such as antibiotics and NSAIDs. This is due to the kidneys receiving such a large blood supply that any circulating drug is delivered to the kidneys in relatively high amounts. Chemicals and toxins, such as those found in flea and tick pesticide products, heartworm medications, or in food and water, can concentrate toxins in the kidneys as well. Cardiovascular disease may also be a cause of CKD in dogs and cats, as kidneys require a large blood flow to do their jobs properly. Blood flows into the kidneys through the renal artery, which then branches into smaller blood vessels until it reaches the nephrons. If this blood flow is restricted as a result of a cardiovascular issue, nephrons will not receive sufficient oxygen and nutrients and become dysfunctional. The low moisture level of dry kibble pet foods and freeze-dried diets can lead to a state of chronic mild dehydration. This can contribute to CKD due to the urine becoming more concentrated, and as a result containing a higher level of toxins. Cats are especially susceptible to dehydration because they should get moisture from their diet and often drink less than dogs. The full complement of nephrons for life is established prior to birth, and unfortunately, animal studies indicate that the kidneys are unable to make new nephrons. The good news is that with a little help, surviving nephrons are, to varying degrees, able to compensate for loss of kidney function. That is why at the Pet Health and Nutrition Center, our holistic kidney disease protocol focuses on feeding a nutritious diet with appropriate supplementation to promote the health and performance of existing nephrons to provide your dog or cat with the best quality of life for as long as possible. Our kidney disease protocol begins with a healthy, whole food, raw or cooked diet. This will allow you to choose better ingredients for your pet's diet and avoid the synthetic chemical additives found in many commercial pet foods. Even though many veterinary practitioners will advocate for a reduced protein diet for dogs and cats diagnosed with kidney disease, Modern science indicates this is not the best approach until your pet is in the final stage of kidney failure. Low-protein diets lead to muscle wasting that can include damage to the heart muscle and do not extend the lifespan of an animal with chronic kidney disease. We recommend that the following supplements be included in the diet to support your pet's kidneys. Our Daily Multi Plus provides USDA organic superfoods that improve overall vitality, along with digestive enzymes and probiotics that dogs and cats need to fully absorb the nutrients from the food they eat. Kidney Tonic is an herbal formula for dogs and cats that supports the vital function of the kidneys as well as the heart, since we know that the kidneys rely on a properly functioning circulatory system. Kidney Glandular provides a variety of whole food kidney-specific nutrients to support the health and function of this important organ in a safe and natural manner. And finally, BioPreparation provides cellular nutrition that easily passes through the digestive tract and enters kidney cells to promote the proper function of existing nephrons. Pet Health and Nutrition Center. Helpful by nature.